Very much. Thank you very much, everybody. I'm really happy to be here. First of all, I want to thank CD, IFMBE, and all our colleagues to make this dream possible, because I told this to Tom and he's making it possible. So I'm really glad that there are many participants, because what we want to do is share what we have been doing in WHO so that you all can see it. So I'm sharing my screen right now. And we will be responding some questions. My colleague Alejandra Vélez is also has joined the meeting. So as you all know, the big three concerns of WHO are the 3 billion, and we're talking about the 1 billion that needs in health emergencies with this big COVID problem. And as you all know, we need to go first through innovation. What is innovation? How can we assess or have these priority medical devices? How can we regulate them? And then how can we do the needs assessment in countries to know exactly what is needed and how can we provide? This has to go through all the levels, from a primary health care to secondary care or tertiary care. And in the list for COVID-19, what we do have is for oxygen delivery systems, that is the topic of today, is we get everything from oxygen concentrators, pulse oximeters, ventilators. So all the items that you see in this list are related to oxygen source or oxygen delivery. And as you know, we have been doing, developing technical specifications for oxygen concentrators, then for guidance for oxygen therapy devices. And then this year in 2020, there are new interim guidance, that is technical specifications for invasive and non-invasive ventilators for COVID-19, and then also for example, for PSA plants. So this is totally new and is coming and is available now in the website. Please remember that oxygen and pulse oximetry, of course, that is like a really a pair, has to be used at primary level, at secondary level, and also tertiary level. In the case that we're having COVID, it has to go all the way, and we have to ensure that it is available for all of them. And let me tell you that these images, I took them from this book, the UNICEF, WHO UNICEF Technical Specifications. This was done along with UNICEF and with many of you as collaborators. Then the second slide shows us that oxygen cannot be by itself delivered. We need the different sources, like a concentrator, a cylinder, a plant, or liquid oxygen, and then we have to be sure that it is distributed correctly, that it is regulated by a flow meter, humidifiers, then the blender, and then the delivery. We need to have the masks and the nasal catheter, the mask, the tubing. So and then we have to do the monitoring, like a pulse oximeter or multi-parameter monitor. In the case of COVID, we're using absolutely all of these options, because we need to ensure that oxygen, being an essential medicine, it has to be delivered. That's something that we know for sure. So depending on the criticality of the patient, we're using ventilators, or we're using CPAP or BPAP, depending if it is invasive or non-invasive. But then we need the other topics that are like voltage stabilizers, surge suppressors. We need to make sure that the ventilators, or whichever we're using, is working correctly. We have in the same book, we have all the different options and all the pros and cons for each of them. You can find them all in the book. And I'm really sorry, the slide is really very little. But what I wanted to tell you is that we have already uploaded the priority medical devices in the context of COVID. And then we have the mechanical ventilator here. Then we have the CPAP, the BPAP, the infusion pumps, and others. So they're all described here. And then it says for what level of care is it needed. Then we have this website. And this website is called COVID Critical Items. All these slides will be shared with all of you, but here we have the critical items, and then we have the a catalog that contains all the devices that are listed in the priority medical devices that are here. and then the technical specifications for invasive and non-invasive, and also oxygen sources and distribution. So all of that is available in the WHO website under this link. I can go to that link, but let me just show you another website. This we just finished yesterday at midnight, so you're the first ones to see it. And it is not in the newsletter that I send on Sunday at midnight, because we just finished yesterday. But this is a new page. And the new page on priority medical devices for COVID has, as you can see here, personal protective equipment, in vitro diagnostics, medical equipment, then innovation, and then global collaboration. So in the case, and for this global collaboration, we also have here the forecasting tools, which I will ask Ale to present. But something that is very important is we also have a place for innovative technologies, but we also have a place for a survey. The survey is here. The survey will be uploaded. It is being uploaded now. We just was trying to upload it before this session. So I'll see if it is already up. But if not, we can send it to all of you. But this is something that we really would like everybody to fill it in. We are linking with all the country offices, but this actually tells, so I just took a screenshot. It goes to ask, do you have a piped oxygen or oxygen concentrators? Do you have is it working, not working? Are the monitors, the pulse oximeters, everything working, not working? Ventilators working, not working? Why do we want this? We want this in order to provide, this is the country information, and then we would need to provide those ventilators or oxygen supply systems from WHO to the countries. So they are being purchased by UNICEF, WHO, and then many other organizations, and they will be sent to the countries. But we need to know what is already there so that we don't get many more things than what is really needed. No? As you remember, we have been working on the Compendium of Innovative Technologies. Well, there is now in our website here, we have innovative technologies for COVID, so I can go there and show you how now we have a page so that you can submit all innovations for COVID so that they can be evaluated. And as always, you know, my last slide that I always use is that a patient is at the end of all the work that we do, and we really need all your not only your technical knowledge, but your passion, honesty, hard work. And together we can make it as the CED slogan. No? And we need to ensure that all the technologies that we do will be of good quality, easy to use, adaptable, affordable, available, accessible, and acceptable. With this, I will end, but I will just want to go back here so that you can see how the website is working. It is here. And then here you have the search calculators, the forecasting tool. That is a tool where you can find Ale, you want to take over and explain the forecasting tool?
Adriana, we need to move on. We can do it during the time, please.
Okay, so it is just for forecasting tool, the tables, the specifications, so everything is here and you can use it. So I think that's the most important. And going back to the PowerPoint, it was on the last slide. Also here, that it is now available in the website too for innovations and so. So I think with that, I can stop, but you will all have the slides and can continue. If you have any doubt, please let me know. Thank you. Thank you, Tom.
Thank you so much. This is very, very informative and very, very precise, very crisp, and on so much punctuality that you've shown, exactly 10 minutes and on the spot. And as Adriana said, oxygen is an essential medicine, and the strategy by which we deliver it has to be as important as it has to be. Thank you so much, Adriana. You are an inspiration for all of us. With this now, we move on to...
Sorry, Amin,
yes.
I will just put the links in the chat so that anybody can open them if they want. Thank you very much.
Yes, Adriana, and in fact, we can, as a subsequent step to this webinar, we'll request the IFMBE Secretariat also to circulate those links formally as well.
Thank you.
Thanks.